There were a lot of questions regarding flight takeoffs and landings and the ear pain that is associated with that. And some have also asked that their kids have been having ear discharge since a very long time, since their childhood, and they are having difficulty in sleeping in the night. So these two questions are related. I will tell you why. It's because, see, the function of the ear is for your hearing as well as balance. Hearing will be optimum only when the pressure outside the ear, which is the atmospheric pressure, is same as the pressure inside the eardrum. That is the middle ear pressure. And see, usually the eardrum is closed. In a normal person, the eardrum is closed. So the function of maintaining equal pressure on either side is by a tube called the eustachian tube. This tube connects the inside of the ear, the middle ear, to the back of your nose. So as you breathe, the pressure inside the nose will be same as the environmental pressure, and this pressure will be taken into the ear by the eustachian tube. So the eustachian tube maintains equal pressure inside the ear as well as outside the ear. So now what happens in in children is, children usually have tonsils, right? The two lymphoid tissues which frequently get infected. Like that, there is a tonsil behind the nose also. That's called adenoids. Usually it has to regress, become less in size and completely go off by 8 to 10 years of age. But what happens is, in some kids it doesn't go off like that. And in those kids, they might have mouth breathing in the night. They might be having difficulty in sleeping in the night and disturbed sleep. Another problem due to this adenoids is, they will go and block the eustachian tube. So when the eustachian tube gets blocked because of the adenoids, whenever any secretions get produced inside the middle ear, that doesn't come out through the tube into the nose. It will get accumulated inside the ear itself. So that is what happens when a lot of secretion gets accumulated inside the ear. At some point, it becomes so much that the child starts crying, it breaks outside and it comes out through the ear. So that is what happens, when that patient said that a lot of, frequently her kid is having this ear discharge problem. And whenever cough or cold is there, the ear discharge increases. That is because the same eustachian tube, whenever cough or infection in the nose is there, that goes into the ear through the eustachian tube. So because of that, the ear gets infected and it starts discharging. Now what happens in the case of flight landing and takeoff is, that when the flight is about to take off, the pressure in the ground level is same as the pressure inside your ear. Now the flight will just take off in such a speed. So what happens is, the pressure outside, say the flight has taken off, it is flying at 2 or 3 kilometers higher than the ground level. The pressure at 2 or 3 kilometers higher than the ground level is much less than the ground level. But the pressure inside the ear is still the ground level pressure. Only the eustachian tube has to, little by little it will start equalizing the pressure. It cannot equalize the pressure instantly as soon as you get taken off. So what happens is that there is a huge pressure difference inside the ear as well as outside in the atmosphere. That is when you are in the skies. So because of this pressure difference, the ear starts paining. There might be some fluid accumulation inside the ear, and gradually as the eustachian tube functions, as you swallow, as you yawn, the eustachian tube equalizes the pressure, and then this pressure becomes equal. Now what happens when you land is, the pressure outside is very low. Like you're in the skies, you're about to land, the pressure in the atmospheric pressure is very low compared to the ground level pressure. And the same pressure is there inside your ear. Suddenly you land, the pressure outside is the ground level pressure, which is quite high. Whereas the pressure inside your ear is still very less, the atmosphere pressure in the skies. So what happens is, the high pressure air outside tries to go inside the ear through the small eustachian tube. It just tries to gush inside the ear. So this causes sudden pain as soon as you land. And in those people who have some cold or cough or some infection or adenoids or rhinitis, in those people this equalization of pressure is very slow, because the eustachian tube is also thickened and it is also infected due to these factors. So in that case, When the air tries to go in through this very thin eustachian tube, it causes a lot of pain. And when the tube doesn't open at all, this pain lingers for a long time, maybe for a couple of days. Sometimes there might be fluid accumulation because the tube is absolutely closed. So because of these reasons, as soon as you land, you might be having these problems: ear pain, difficulty in hearing, severe fullness of the ear. So what can be done in these two cases? In the first case, when we spoke about the children, what you have to do is this: these children who are having repeated ear discharge, they need to go to an ENT doctor. We need to rule out if there is any blockage inside the nose or behind the nose, if adenoids are still there. This can be done in two ways. You can either take an X-ray of the face and the neck to see the adenoids, and you can also do a small endoscopy of the nose to check for adenoids. In the second case, during flight landing and takeoffs, it is always better you avoid flight journeys if you are having an upper respiratory tract infection like cold, cough or running nose. But if still you have to undertake the journey, then the best method is you can take some chewing gums and warm water with you when the flight is taking off and when the flight is landing. In fact, you should not wait for the landing to start, because the flight will be still descending gradually before it lands. So half an hour before the actual landing time, you can start sipping some water. By every 5 minutes, 3-4 minutes, you can sip some warm water. So when you sip warm water, the eustachian tube opens, and this will help in equalizing the pressure so that a sudden equalization can be prevented. Another method is you can use a chewing gum. When you chew the chewing gum and when you swallow the juice of it, then also the eustachian tube opens. Whenever you swallow, you are actually manually opening the eustachian tube. So in that case, you can you can use a chewing gum, or you can sip some warm water when you are descending as well as when you are taking off. Another method is half an hour before the takeoff and half an hour before your landing, you can use this Otrivin drops. You can use it in the form of a spray. Just keep it inside the nostril, 2 puffs here and 2 puffs here, half an hour before you take off or half an hour before you land. This can help decongest the nose, improve the airways, also open the eustachian tube on either sides. So this way you can prevent any pain that occurs after landing or after taking off due to middle ear pressure difference.